Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
So now, if you see the pathogenesis of diabetic retinopathy, so in the pathogenesis of diabetic retinopathy, actually there is aldose reductase. This aldose reductase will convert the glucose to sorbitol. Okay, what does this sorbitol do? This sorbitol will activate the protein kinase C. Okay, this protein kinase C will result in oxidative stress, number one, and it will also result in this will also result in increased production of vascular endothelial growth factor A. It will also cause increased production of insulin like growth factor, epidermal growth factor, platelet derived growth factor, and transforming growth factor beta. Okay, so all these growth factors will cause endothelial and metabolic dysfunction. So all these growth factors will result in endothelial and metabolic dysfunction. So because of this endothelial and metabolic dysfunction, this will result in microangiopathy. So these endothelial and metabolic dysfunction will result in microangiopathy, and thus there is development of diabetic retinopathy will occur.
thank you and thank you for watching.